Hi, my name is Demi.
Hi, my name is Shreya.
Hello, my name is Joseph.
Hi, my name is Ali.
Hi, I'm Lowenna, one of the RCPCH and OUS podcasters. This podcast will be looking at working with children and young people to help improve their health and the health of others. Have a listen for ideas, examples, and information on engagement from RCPCH doctors and young people from RCPCH and us. We hope you enjoy it.
Hello, I'm Joseph, one of the RCPCH and US podcasters, and I wanted to explain our jingle to you. In summer of 2022, young people were helping out with interviews for staff at RCPCH, and in the break time, learnt a moo. Another young person remixed it, and that's why we have a dance moo as a jingle. It means a lot to us, and we hope you enjoy it too. Thanks!
Hey, my name is Shouja. I'm a consultant paediatric nephrologist, that's a kidney doctor, in Wales. So one of the things that I do as a kidney doctor is work with young people who are transitioning into adult services. And another one of my interests is education.
Would you like to tell us any more about your own project?
Yeah, sure. So one of the things that we've noticed in renal medicine is that once young people transition, it's a really rocky period for them. They've lost a lot of the support around them. And in particular for those that have a renal transplant, we know that it is the peak time in their life that they will lose their grafts. It's really sad, but it's something that once it's happened can't be taken back. So one of the things that I'm trying to do is to try and empower young people to be in more control themselves, and to know how to get help when they need to have help, how to get on with life. The reason is that we manage the medicine but not necessarily help young people through life challenges. Just a few weeks ago I was with some young people who were my friends actually. We were kayaking, we were in the sea, we were jumping off cliffs, climbing up walls, and we were doing all of that as part of a youth residential whereby young people can talk to each other, share experiences, but at the same time they can see that we doctors are actually human beings too and have interests as well, and we can actually be good friends. What I wanted to do to begin with is ask, where is our service falling short? And you need more than just numbers and outcomes to be able to judge that. What you need to do is actually get to the level of the people that are using the service. So at a camp setting like I've described, we've had focus group sessions with our own service users and ask them what's going good and what's not so good, and where can we improve and what needs to happen. And they shared so much information with us, which is why we're using that information to develop this program, which will include peer support. It'll be held at a youth club, but it'll tackle a lot of the subjects to help to engage and empower and promote autonomy, really, to empower young people to look after their own selves. Personally, on these camps, the young people have taught me that you can easily overcome your boundaries. You just need to have the door opened in the right way and have a hell of a lot of motivation. I really like forming relationships with my patients. I was the first doctor in my department to start writing to young people, and my consultations always take ages. I always run over because I just like chatting, finding out about life, and try and set the agenda to the young people. It makes it harder though, because when things are challenging and hard, you take it really personally, and quite often people will be contacting me even out of hours. But that's what makes my work more enjoyable.
Could you tell us what well-being means to you?
I think it means that you can face life obstacles without derailing. You know how to get around it without losing yourself as a person.
And so how can the RCPCH sort of support you in everyday work you do and forming those bonds with young people?
We have got the voices of our own young people feeding into our programme, but what we don't have necessarily is oversight and input from young people and organisations like RCPCH. I have multiple sources of inspiration, but I'm thinking of one of my colleagues and one of my peers, And, she took me from a very junior doctor and helped me to become who I am. In fact, she's a nephrologist, and it's just seeing her as such an amazing doctor who does all this youth work. She got me involved. And then I saw her and I thought that's the kind of doctor I wanted to be like. So, and lo and behold, I ended up as a nephrologist working alongside her. I don't think that's a coincidence. I'm sure that's in part down to her inspiring personality.
Hi, my name is Ali. The animal I am today would probably be a koala, just because that was the first one on my mind, because I used to really, really be obsessed with koalas. I can't explain why.
Hello, I'm Joseph. I think my word of the week would be gold, because I've discovered lots of new stuff. Why engagement matters to me is because if there's not much engagement, children might not necessarily want to talk about their problems, and they'd probably suffer without anyone else really knowing or being able to help. Top tip for engagement would be let the child speak freely, and don't always involve the parents, because they might get too involved or in the way sometimes.
So hello, can you tell us your names and what you do?
Hi, I'm Louca-Mai and I'm a researcher at the University of Hertfordshire, and I do research around young people's participation in health services and research.
And hello, my name is Kath and I'm a children's nurse by background, and I work at Barts Health, and I have a real passion for engagement directly with children and young people about their voice in their care.
I think one of the things that I find as a researcher is we don't know enough about the impact of participation. There's a lot of people generally now understand that it's a good thing because of work like, the RCPCH and Us Young People, the NHS England Youth Forum. There's all this really exciting work that's going on. But I don't personally think that we know enough about what impact it makes. It's also about children's rights, and in particular the UN Convention on the Rights of the Child, and that children and young people have a right to have a say in things that affect them.
I went to a brilliant session yesterday that was led by the Association for Young People's Health and also Dr. Helen Jones, a GP, and she's taken primary care services into that youth centre right next door to a secondary school, alongside sexual health services, alongside mental health services, alongside youth work provision, where a youth worker is the receptionist. And they will actually be with that young person as they actually navigate through any of those services, but importantly will actually provide that ongoing care. Now that service was delivered as a direct result of a local GP engaging with her local children and young people about what mattered most to them. There was a young man, and he took me aside, and he must have been about 13, 14, and he said, I've just spent 6 weeks in my local district general hospital. And he wrote me this note, and the note said, please try and engage with us a little more. We're worried and we're scared. His plea to just seek out their views, to engage them in their care, to be a bit more compassionate, and to understand how frightening it can be to access healthcare really has driven me on to go, what other voices are there that we're not hearing? How do we hear them? And one of the great things that was established when I used to work at NHS England was the NHS Youth Forum. So that was 25 young people recruited from across the country to challenge us and to hold us to account. They did some fantastic work on youth rights, the right to confidentiality, the right to actually give consent, the right to be heard in their healthcare. They also raised issues about the importance of educating teachers. Have teachers got any idea what it's like to have a long-term medical condition and how difficult it is to even get up in the morning sometimes, let alone actually contribute within an education environment as well?
So they involve children and families in designing the service, in recruiting the staff, kind of all the way through. And the project that we did together was what's called an action research project. So we worked together to co-produce a participation strategy, ask some young people their views, and more, can we work with young people to decide what needs to happen, and then can they be involved in making it happen as well?
Sometimes I find that young people and children are rather scared to speak about their views towards their own healthcare. So how would you encourage them to speak up and express their views?
Online's tricky. It excludes some people, but it actually makes things easier for others. And I certainly work with some young people who will find it really hard to speak up in a room, but are very, when you're saying doing a Zoom meeting, they won't say a word, but they'll just be posting stuff in the chat all the time. So I think giving people other options, and just you can hear people's voices without necessarily having to speak. Because not everyone feels comfortable coming along to a meeting, somewhere they've never been before. Not everyone wants to be a member of the group and come to something regularly. So I think it's just being flexible, and people might do a one-off thing and then think, oh, I like this, I'd like to be involved more, and then get involved, but rather than having to sign up straight away. But also going out to where children and young people are, so schools, services, places where they feel safe, where you're going into their space rather than them coming into yours.
If children and young people are actually coming for appointments, can they have a think about them before? Can they actually, if they've got any questions, can they jot them down? Can they actually come to that, having just given that little bit of thought? It might not work for all children and young people, but I think we as healthcare professionals, by our body language in terms of eye contact, coming to their level, saying that their views are really valued and that we want to hear their voice, and actually introducing ourselves directly to the child and then to the parent carer is really, really important. We need a skill set almost to work with babies, because actually it's really important that we take a note of when their heart rate goes up, when their respiratory rate goes up, because that's indicating how we're engaging with them, how we work with younger children, how we work with school-age children, and also how we work with young people. And there are slightly different skills and nuances for all of those various age groups, and I think that we need to do more to pay attention to that in their care and in broader participation and engagement as well.
I mean, the biggest inspiration for me has been, working with a wide range of children and young people. It's just kind of, learning to constantly kind of think on my feet, because obviously however, I think I'm going to approach things, inevitably when I'm working with young people, it's not going to work with everybody, and you have to change tack, or they have quite often much better ideas about how to make things engaging.
The last 15 or so years of my career, actually my energy and inspiration comes directly from listening, engaging and working with young people.
That's great, thank you. To finish off, I just want to ask you both, obviously, very into engagement with children, so I was wondering if you have like a favourite go-to joke.
This is where you get silence.
Yeah, it's where I put you on the
Oh
spot.
my goodness. A favourite go-to joke. You've stumped me.
Now.
You've absolutely stumped me.
Hi, my name is Demi. My word for the week, I think explorer, because I'm always like searching for answers and I love learning, so.
Hi, my name is Shreya. Engagement matters to me because children and young people need to be heard. So many great things could be improved if we were listened to, and engagement is the way we can make this happen.
Hi, Ali. Welcome to our podcast today. Do you want to tell us a bit about yourself and what you do engagement-wise?
Hi, Shreya. I'm Ali. I use she, her pronouns, and I am part of the Lowenna project, which is a charity run mainly by disabled young people for other disabled young people. And I'm really excited to be talking about engagement with you.
Thanks. So what got you involved in engagement in healthcare for children and young people in the first place?
Lowenna was really born out of trying to think about how we can have these conversations about young people's health better. It was myself and two friends, Beth and Ross, who started Lowenna, and it kind of came out of a conversation that we had at the end of our first year of university, where we were kind of reflecting on the year that we'd had at uni, where we have chronic illnesses, and thinking like, wow, it feels like we've had such a crazy year where all this stuff has happened, and we'd been thinking about going to uni. We hadn't heard anyone say like, oh, you know, how are you going to manage if you have a health crisis when you're so far away from your family? Or, oh, how are you going to start having conversations with people that haven't known you your whole life about your health? And we're like, hang on, you know what, this must be a challenge that other people are coming up against. Maybe it's just that people aren't talking about it. And so we're like, right, we started off just doing a blog, and very quickly a lot of people got in touch, other young people saying like, oh, I found it so helpful, and oh, I had the same experience but hadn't heard anyone else talking about it. And so we wanted to give a platform for people to share their experiences and really reach the people who would be able to make decisions that would be able to make these things easier and better. Probably the main thing is just how important engagement done well is, because like I said, there's all of these young people having these experiences, but they don't particularly want to be doing anything about it because they've had these disempowering experiences. The thing I've learned is that ask these people and they will change everything for the better. In Luna meetings, there's normally about 20 of us. We'll have all these amazing ideas. And I'm like, oh my goodness, I wish that the people with the money could just hand over their checkbook, hand over their decision-making powers, and just let young people do it. The other thing that I've learned with Luna is just how important community is. Say if you've got something like epilepsy, 1 in 100 people have epilepsy. So probably in your immediate circle, you don't know anyone else who has epilepsy. Actually, it's really important to make an active effort to try and connect people up. And it doesn't have to be someone with epilepsy being connected to someone with epilepsy, because a lot of these challenges are similar. Someone with endometriosis, say, and someone with ulcerative colitis, actually, there's a lot they can bond over around like fatigue, accessible public toilets out and about. A lot of problems and conversations really go cross-condition.
And I would want to ask you, have you seen the impacts of the Luna project like across the country, and have you had anyone from like outside England / the UK talk to you about what's been going on in their countries?
Up until a couple of weeks ago, our member who was the furthest away, we had a member up in Thurso, which is at the tip top of Scotland, and a member down in Bath. A couple of weeks ago, we actually have had someone join our group who is based in South Africa. So now that has made Bath not seem that far south anymore. You know, the joy of being able to do things online. Before the pandemic, we were meeting just like in cafes in Glasgow, and we moved online, and like there's definitely no going back from that. It makes it so much more accessible for people to get involved. Very kindly, someone nominated us for a National Diversity Award. When voting closed the other day, I got to look on there and see these things that people had written, and honestly, it had us all crying. And you know, there was a lot of people there saying like, this is what they wish they'd had a couple of years ago. You know, people saying that they'd read a blog post and it had made it so much easier for them to talk with their friends about their condition. People saying that they would forward our blog post straight onto family members, friends, teachers. That means a huge, huge amount to us.
It's amazing to see how far the Luna project has reached, especially having someone in South Africa. What have you loved the most about getting involved in the Luna project?
I've met amazing people who are doing amazing work and get to like make their ideas a reality, and that's amazing. Seeing how people grow and change when they're part of Luna. Quite often, first couple of meetings, pretty quiet, maybe just putting stuff in the chat, and then a couple of months down the line, like, you know, being like, actually, we need to do this, and this is not right, and let's do this. And it's amazing.
That's just really inspiring. If you had to pick one thing that could be improved on, what would it be?
The 3 biggest things: getting this work we're doing out further, getting more people involved, and getting more funding to be able to make all that happen. If we got some funding that was just do whatever you want with it, then I would take everyone somewhere, just somewhere in the UK, but like somewhere where we could all be in person together, because most of us have never actually met in person. We have 3 working groups. So we have a resources group that focus mostly on creating and distributing resources, a media group which focuses on social media, getting people on to do takeovers, doing infographics, that kind of stuff. And then we have an ambassador scheme to be run in the last couple of years of high school, with the idea that kind of 16, 17, 18-year-olds learn about ableism, allyship and advocacy in relation to disability.
If someone wanted to get involved in the Luna project and start volunteering, how would you suggest they become part of it almost?
Our email address is the Luna Project UK on social media at the Luna Project UK.
The Luna project sounds truly amazing, and it sounds like a great community of people who are trying to improve children and young people's engagement in healthcare. Thanks for joining us today, Ali, and we really hope that the Luna project continues thriving.
Thank you so much, Shreya. Thank you.
Thank you for joining us for our first RCPCH and Us podcast, and to everyone who took part. We hope that by sharing our voices and empowering examples of engagement, you are inspired to be creative and get involved. Engagement is the way we can make this happen. Please ask what children and young people think, listen to our voices, and together we can create outstanding child health services.